Awareness at Chelsea Hospital, Sarah Wilczynski. Sarah, welcome to the show.
Hi, thanks for having me.
Yeah, and nice to have you right now because we are right smack dab in the middle of Mental Health Month. And that's a big month for you.
Yes, yeah, my busiest month for sure.
Now, throughout the month, the hospital is conducting a number of mental health awareness activities. What are some of the things that you're up to and where this month?
Yeah, so like you mentioned, we have lots of activities going on. The first being working with local libraries in all of our 5 towns, actually. So Chelsea, Dexter, Grass Lake, Manchester, and Stockbridge, to host mental health book displays. And in these displays, we have media guides that highlight apps, books, and podcasts recommended by social workers, counselors, librarians that focus on mental health topics. Next, we're working with the Chelsea Farmers Market to have a food and mood booth. So we're going to be talking a little bit about, what you eat and how it can affect your mental health and your mood. And the last thing we're really focusing on this month is mental health trainings for our community members. So the first being Question, Persuade, Refer, which is a suicide prevention training. It's 1 hour online, self-paced, and it's great for an introductory overview of kind of mental health and what you can do. And we're working with Stockbridge Community Schools to host a youth mental health first aid training. And this training kind of teaches participants how to recognize signs and symptoms of mental health challenges in our youth and how to help them seek help. And so that's happening next week. And we're really excited for all of our activities and to bring these trainings to our local communities.
Very interesting because I think everyone knows to improve physical health requires, things like exercise or cutting drinking or smoking. But mental health, there's some things you can do, physical things you can do that are going to improve your mental health. Food. So I'm thinking if we eat a lot of junk food, that might put us in a bad mood. Is that where you're going with that?
Yeah, so, eating junk food can be helpful if you feel like it can be helpful at first. But in the long run, you can run into sugar crashes and things like that, which will affect your mood. So eating, healthier foods or things that boost your serotonin levels are all wonderful. But obviously everything in moderation. We're not telling you, no, don't ever eat that. Sometimes you need a piece of cake on a Tuesday. But overall, trying to choose those healthier options are better for your mood and mental health.
Yeah, and I guess anyone that works out knows that you feel better, mentally after a workout. So that's part of it.
Yes. Yeah. Physical activity is great for your mental health, whether it's, just increasing serotonin levels, but also just the healthier your physical body is, usually your mind kind of follows, and it gives you an outlet to, reduce some anxieties or stressors. And gives your brain kind of that time to think through some things while you're getting some physical activity in. Is
it tough to talk about mental health? Have you found, as awareness coordinator, that you've got to talk about it? Are people, are they reticent about the topic?
Yeah, so overall, we have really positive feedback from our communities. So really these activities and the grant that I work with, which is the Mental Health Awareness and Training Grant, really came because the community said we need this. So Chelsea Hospital does a community needs assessment every few years, and mental health and substance use disorders has been a top need identified since 2016. So really, this came from our communities who were saying, we want to do something. How do we help fix these challenges and losses that we've been seeing? So this really gives them something to do. And with this grant, we've had a lot of partners coming forward saying, we'd love to have trainings or host space for you or have you come talk to our club or organization. So the feedback's been great. You do get, people sometimes who are a little like, where is this all coming from? And we didn't have this, 10 years ago, for example. But really talking with them about how it was there, just, we're talking about it more. So you're hearing about it more.
Yeah, and now with this grant, that you wrote and have been awarded, you are able to offer services for no cost.
Yeah, so that's the great part about this grant. It's $125,000 a year for 5 years, which allows us to offer, the trainings that I've mentioned, as well as some that we're looking into specifically for law enforcement, partnering with, the Washtenaw Sheriff's Department and Chelsea Police Departments and Stockbridge Police Departments and others in the future. We're able to offer those at no cost and then work with our youth to offer anti-stigma campaigns in all of our communities. So youth, as we've learned, aren't as apprehensive about talking about mental health. And so really taking their expertise and sharing it with our adults and, what they're seeing and experiencing and what steps we can take to address maybe some of the gaps that we have in our awareness and knowledge of mental health. And so we're able to do those all for free in our communities. And we're really excited that we're able to offer all of that.
Sarah, one of the things about mental health that really people do not like to talk about is suicide. But there are some ways that people can improve their awareness of the signs of suicide, because that's the first thing everyone always says is, we had no idea. There was no signal, there was no sign. But there potentially are, and there's some training that you now offer that it's essentially for anyone, isn't it?
Yes. So the first thing I do want to mention is that you can only do what you know how to do to the best of your abilities. So, if something's happened in the past, it's not your fault. You didn't know. But we do offer question, persuade, refer. And so this specifically is a suicide prevention training that teaches you kind of the warning signs and symptoms of suicide. And so this training is offered to anyone 14 years or older. Currently, we do have an online self-paced version available to people, and we are working to offer in-person trainings as we're able, obviously pending, safety factors in our community with, things that have been going on. But yeah, it's a great training that really highlights a lot of those things. We've had great feedback, and we do have a lot of organizations that are offering it to their employees, which is wonderful.
Another thing that falls into the mental health arena is addiction issues. Either they're caused or caused by addiction, and you're working on some training for students when it comes to addiction. Tell me about that.
Yeah, so yes, mental health and substance use are inexplicably related. Which way it goes, it can be both. And so I specifically work really closely with our Seriously programs, which are in Chelsea, Dexter, Manchester, and Stockbridge. And we're looking in Grass Lake with some organizations we can work with as well to address substance use and how it can relate to mental health. What we've been hearing is students use it as a coping mechanism, has been pretty common. So what we're working to do is bring teen mental health first aid into our school districts. And so this is a version of mental health first aid that's adapted for students in grades 10 through 12. And so this training focuses on, how to help peers if you've noticed they're struggling with mental health or substance use and kind of the signs and symptoms of that. Because one thing we've also heard from our students is, how do we help someone? You can teach us coping mechanisms, and that's great. We love that. But how do I help my friends, whether it's mental health or substance use? And so we're working through that. We have one school that's ready to hopefully get it implemented next school year. So excited for more to follow.
I know you're fairly new in this role, but it sounds like you bring a lot of energy and enthusiasm when it comes to mental health awareness. Tell us a little bit about your background in getting you to this position.
Yeah, so I graduated from Grand Valley State University with a master's in public health in 2019, really focused on child, youth, and maternal health. So I'm right in that field that I love. I started with Chelsea Hospital in June of 2019 as a coordinator for the Seriously Dexter and Seriously Manchester programs. So it's great that in this new program, I've still been able to work with the people I've worked with and the youth that I've worked with. So in this position, I moved into it in November of 2021, so shortly after we were awarded the grant. And I'm really bringing kind of that passion for, how substance use is related to mental health into the new role, with the background that I've had doing that for the last few years.
And Chelsea Hospital offering mental health services right there in Chelsea, but you also you have like a road show you take to the 5 healthy communities as well.
Yeah, Chelsea is a great health system to work for, and I've been really lucky to work with people. But yeah, so we have services right in the hospital, but we also have our behavioral health navigators, Abby and Kathy, who are great in terms of, you can call them or email them, and they're there to help connect you to resources in whatever county you're in. And so this is really important because Chelsea does service up to 4 counties, including Livingston, Washtenaw, Jackson, and Ingham. And so you do run into that issue of, you can call someone, but maybe they don't service your area. And so our navigators are great in terms of finding what you have available to you where you are. And so they're a wonderful resource. We're very lucky to have them, and I'm really lucky to get to work with them on this grant as well.
Nice. So what do we call it? The mental health awareness training, is it MHAT or MAT for short?
Yeah, we call it MHAT very lovingly. We enjoyed it. It's less of a mouthful that way as well.
And if someone wants more information about that, there's a section on your website. They can get all the details.
Yeah, it's stjoeshealth.org/MHAT. Great.
Well, we appreciate you taking time with us, and hope we help improve everyone's mood, attitude, and at least their mental health awareness this month.
Yes, thank you. I really appreciate being on the show today.
Appreciate you taking time to be with us. Thanks, Sarah.
Thank
Sarah
you.
Wilczynski, Program Coordinator, Mental Health Awareness at Chelsea Hospital and Trinity Health. Lots more coming up on today's show. We are going to celebrate some birthdays next.